2014. Good morning. Good to be with you. I'm Anne-Marie Green. It's 5 years in prison for South African track star Oscar Pistorius. This morning, the judge read the sentence in the shooting death of Pistorius's girlfriend. The former Olympian was convicted of culpable homicide for shooting Reva Steenkamp last year. He was also given a 3-year suspended sentence on a separate gun charge. Police officers led Pistorius from the courtroom to a holding cell. And this morning, hospitals in this country have new guidelines for protecting healthcare workers treating Ebola patients. The CDC advice deals with more stringent rules regarding protective gear. Susan McGinnis is in Washington with the details. Susan, good morning.
Good morning, Anne-Marie. After 2 nurses who treated Thomas Duncan in Dallas got infected, the fear, the finger pointing, and the questions have piled up. Did they follow the protocols? Were the protocols adequate? Were there even protocols? Healthcare workers have been pushing for new standards for their protective gear, and late Monday, they got them. While 260 people in the U.S. are still being monitored by the Centers for Disease Control for Ebola symptoms, the agency issued new steps to ensure no more U.S. healthcare workers contract the virus. CDC Director Tom Frieden announced the revised standards yesterday. Among them, that healthcare workers wear protective suits that leave no skin or hair exposed and use a respirator over their face instead of just goggles.
One of the critical aspects of these guidelines is a very structured way of doing that, step by step, which is supervised and, in a way, ritualized.
The guidelines come after 2 nurses who treated Ebola patient Thomas Duncan became infected. While it's still unclear how they contracted the virus, health officials say the greatest risk lies in how healthcare workers remove their protective gear.
There is some sort of fluid on the front of that gown and you take it off and come in contact with it, well, that could be a very deadly mistake.
The CDC last updated its guidelines for treating Ebola over the summer, but admits the infection of the 2 nurses proves they were inadequate. The agency also plans to ramp up training of healthcare personnel across the country to help prevent more transmissions. And now a trained monitor must supervise workers putting their equipment on and taking it off. Now, at Emory University in Atlanta, where Amber Vinson is being treated, one of those nurses, an American doctor who is being treated there for Ebola since early September, has been released. Ashoka Mukpo, the photojournalist who is being treated in Nebraska, could be released by week's end. Anne-Marie?
All right, Susan McGinnis in Washington, thank you for